Dr. Goldberg here, continuing our infectious disease series. Today we're talking about rabies and rabies encephalitis. This is obviously a fatal disease by and large. Rabies is in the Lysa family of viruses. It's a neurotropic virus, RNA virus. There's about 11 different types. Incubation period is typically about 1 to 3 months after the virus gains entrance into the human body, but it can be as long as 1 to 6 years. There's only been about 50 or 60 cases in the United States over the last 25 years, but unfortunately worldwide, thousands of people die from rabies every year. So depending on where the bite is, it moves faster. The disease moves faster if the bite's in the upper extremity versus the lower extremity. Once the virus is deposited in the peripheral wound, retrograde passage occurs up the dorsal root ganglion and then to the brain. The virus moves about 5 to 10 centimeters a day, and it produces a severe neuronal dysfunction and significant hydrophobia with encephalitis type symptoms. Once it gets to the central nervous system, it then will spread to the heart, the skin, the salivary glands, etc. There's really 5 major animal reservoirs. Obviously, bats are the most dominating source in this area. Raccoons, skunks, foxes, and coyotes are 2 through 5. There's no rabies in squirrels, chipmunks, rats, hamsters, gerbils, guinea pigs, mice, rabbits, and those types of animals. With a couple of exceptions, no patients that's been exposed to rabies and not been vaccinated before the onset of symptoms has ever survived. There have been a few survival cases. Once somebody is exposed, though, and goes to the emergency clinic, good wound care with thorough washing of the bite wound or scratches is extremely important. Tetanus prophylaxis is then recommended, as well as human rabies immune globulin, 20 international units per kilogram, infiltrate around the wound, and then any remaining should be given intramuscularly. The HDCV vaccine should be given IM in the deltoid muscle, 5 doses on days 0, 3, 7, and 14. Unfortunately, the vaccinations are extremely expensive. And as I said earlier, more than 40,000 people get post-exposure prophylaxis per year. So there's been a worldwide shortage problems with HRIG as well as HDZV over the last several years because of that. There have been a couple of people that have survived rabies with the use of intravenous or intraventricular ribavirin, IV interferon, IV ketamine, and Versed, which has been effective, like I said, in a particular patient at Children's Hospital in Milwaukee, Wisconsin. Amantadine has also been utilized as an antiviral agent, but by and large, people obviously do very poorly with rabies. So just a quick update on rabies. Hopefully this is helpful. Thank you, Dr. Goldberg, signing off.